Hello and welcome to our short introduction to health literacies. My name is Morag Fletcher and I'm the Adult Learning Manager for the Council.
And my name is Mary McLean and I am Class Fellow Manager with Public Health.
For the purpose of this input, we'll differentiate between health literacies and general literacies. So when we're talking about general literacies, then perhaps an adult would struggle to read information off a poster and be able to interpret it and make sense of what the information is in all aspects of their life, or they might struggle with spelling or being able to read larger words or longer text. In health literacies, we're talking about someone that maybe just struggles with the jargon that's used in a health setting or with acronyms that are used in a health setting. In other aspects of their life, their literacies are fine.
Think of health literacies as an umbrella that protects people from health problems and risks. Health workers should be aware of these three areas. Number one, improving relationships. They need to be aware of a person's cultural background, for example. Number two, they should use clear and straightforward, commonly used language, including on signage. Number three, working together, organisations, partners should work together to ensure all information is accessible. This includes the use of language line for translation.
The health literacies in a pandemic. So the World Health Organization had already highlighted poor health literacy as an underestimated health problem globally. So during the pandemic, they were heard to say that we're not just fighting an epidemic, we're fighting an infodemic. So if you think of the information that came out when we were within that coronavirus time, the initial information was coming out in public health adverts on the television, and they were using language and terminology that was new to everyone. So everybody was struggling to try and keep up with what was being said at that point. And then we all received a letter from Boris Johnson, which was a full-page letter on very formal headed paper. So some people that were going to be struggling with any level of literacies there would probably struggle to have read and understood that letter. So that was a unique situation, and we're all learning new information, and we were all learning new information every day. So we're not in that situation all the time.
You can see from the slide we have two examples of labels. Someone with low level literacies may struggle with these. For example, someone may not know what 5 ml stands for. They don't take more than 12 hours. That can be really confusing. People could end up not taking the correct dose or could give up altogether. The layout of the information can cause a lot of confusion. Sometimes it's just too small and squashed together for a person to decipher. Even confident readers can struggle with this. I know I do with some labels, even when I'm wearing my glasses. I find it really difficult to read. So don't be frightened to ask a chemist if you can't read a label properly.
So here we have the back of a bottle of Calpol. If you have a wee look at that. Now the information tells you that for a baby that's 2 to 3 months old, you can only give them this medicine if your baby was born weighing over 4 kilograms and was born after 37 weeks gestation. So that might be a lot of numbers for someone to think about already before you move on to the 3 months. The birth weight and gestation weeks are not mentioned, so does that still matter? Do you still have to take that into account? And on top of that, you've got a different dose depending on the age of the baby or child. So you might be given 2.5 mils, you might be given 5 mils, you might be given 7.5 mils. So that can be quite confusing for somebody who's trying to work out the best thing to do for their child.
This is an example of a hospital appointment letter. It's actually based on a real letter. It's just that all the names have been changed. As you can see, there are contradictions in the layout, and that can be confusing to any reader. Full capitals are used in some parts, and underlined in others, bold in others, sometimes both. There's also the use of the two styles, time styles, 2 p.m. and 1500 within the same letter. The email address, if you can see, the email address is not blue and underlined, which is the normal style of email address. And also at the bottom, why does it say may? Does that mean may not? And will they be left without the treatment they need?
So here's an example of some of the jargon and terminology that we're talking about. So if you can have a wee look at the slide there, you'll be able to see what the jargon is and what it actually means. But for example, malignant and benign are often confused by people, especially when you're nervously waiting for results. So you know that there's one of them that you want to hear and there's one of them that you really don't want to hear, but that can get confused when you're nervous and you're waiting for results and you're already stressed trying to take in the information that you're being given. So again, if you don't understand a particular word that's being used in a health setting, please just ask whoever's talking to you, whether it's a doctor or a nurse, just ask them to explain what it is they're talking about. There's some tips here now that Mary's going to go through with you.
Some tips, but we should say that we've done this training with frontline workers, so they should understand these methods that we're suggesting. Time, don't let the medical person speak over you and suggest what they think you're going to say. Make sure the question you ask the question that you want the answer to. Coping strategy, use this if you feel that you're about to panic. For example, say that you've forgotten your glasses. If you're given something to read, and this will give you a minute to draw breath and settle yourself. And also finally, don't allow yourself to be rushed. Make sure you feel that you've understood everything. If you get all the information you want this time, it may save you having to come back again.
Okay, so teach back method will give you a wee explanation of what this is. So this is something that's used in medical settings, and what it really means is that the medical professional will explain something to you and then they'll ask you to tell them in your own words what it is that you think that they've just told you. Okay, so it's just a way for them to make sure you understand what's being said. So when they're doing this, don't panic. It's not a test. They're just checking your understanding. And they should be doing that, what's called chunk and check. So if they've got lots to tell you, they should stop partway through and ask you if you've understood that bit, then give you another bit of information, stop again and ask if you've got that. So it should be a reassuring conversation. And again, there could be ethical implications here. So if somebody needs to give consent for a procedure, then they really need to be able to understand exactly what it is they're being asked. Okay, so if a person fully understands their situation, what they need to do and when they need to do it, they're more likely to adhere to the treatment plan as they know what they're doing at each step. Now, an example of a doctor using this teach back method would be, so this is a new diagnosis for you. I want to make sure that you understand. Will you tell me in your own words what I've asked you to do about your chest infection? So then you would just reply in your own words, and then it's up to the doctor to make sure that he knows that you have understood correctly. So for example, you could respond by saying, I have to collect a prescription for antibiotics, then I have to take 1 tablet 4 times a day for 5 days, and I also have to keep hydrated, so therefore drink lots of fluids. So the doctor should then be reassured that you've understood clearly what you need to do and why.
Now, here are a few quiz questions you can have a look at and see if you're able to answer correctly. Now at this point, you can pause on the slide and give yourself a few minutes to answer. And the answers are for A, TSP stands for teaspoon. B, it's disease A, as 1 in 10 is equivalent to 10% and 1 in 20 to 5%. This is the one that confuses quite a lot of people. C, respiratory droplets. And D is false. Each year there are different strains around and new vaccines have to be prepared with them. Now, finally, if you have any questions for us, we will give you our details again. And please feel free to get in touch. And we will leave you with this quote from George Bernard Shaw: "The single biggest problem with communication is the illusion that it has taken place." If you have any suggestions on how we could improve this, this is very much a pilot, so if you have any suggestions how we could improve it, delivery, please get in touch with us, and thank you.
Thank you.